Chickenpox vaccination is about to become a game changer for children in England starting next year, and this is a move that sparked plenty of discussion. From January, the NHS will offer a free chickenpox vaccine to children for the very first time. But why now? And what does this mean for families? Let's dive into the details. First off, what exactly is chickenpox? It's a highly contagious illness caused by the varicella zoster virus. And it's quite common across the UK. The infection typically leads to an itchy rash, along with symptoms like body aches, fever, and a loss of appetite, according to the NHS. Most children catch chickenpox at some point, with about 90% having had it by the age of 10, based on data from the UK Health Security Agency. Usually, the illness is mild in kids, but adults who haven't had chickenpox before often experience more severe symptoms. Here's an important fact that many might not realise. Once someone recovers from chickenpox, the virus doesn't completely leave the body. Instead, it lies dormant and can reactivate later in life as shingles, especially when the immune system weakens. To combat this, the UK has been running a shingles vaccination programme for older adults since 2013. Currently, the chickenpox vaccine isn't widely available on the NHS for everyone. While private clinics offer the vaccine for around £150 for 2 doses, the NHS provides it free only to specific groups. These include children and adults who are in close contact with people vulnerable to severe chickenpox infections or those with weakened immune systems. Additionally, there's a separate shingles vaccine available on the NHS for adults aged 65, those between 70 and 79, and individuals over 50 with significantly compromised immunity. So, what's changed with the government's recent announcement? Starting in January, GP practices across England will begin offering eligible children a combined vaccine that protects against measles, mumps, rubella and varicella chickenpox, known as the MMRV vaccine, as part of the routine infant immunisation schedule. This decision came after careful consideration and expert advice from the Joint Committee on Vaccination and Immunisation, JCVI. Research highlighted the serious impact that severe chickenpox cases can have on children's health, including hospital admissions and the financial burden on the healthcare system. It's worth noting that healthcare policies differ across the UK, so Wales, Scotland and Northern Ireland manage their vaccination programmes independently. Remember those chickenpox parties some parents used to host, where kids were intentionally exposed to the virus to get it over with early? Those days are fading fast. The introduction of a vaccine not only spares children from the misery of the rash and discomfort, but also prevents dangerous complications. While rare, chickenpox can lead to serious issues like bacterial infections, pneumonia, brain inflammation, and even stroke. Tragically, some of these complications can be fatal. Beyond protecting vaccinated children, the vaccine helps reduce the spread of the virus in the community. This is crucial for safeguarding adults who never had chickenpox, including pregnant women and their unborn babies, for whom the infection can pose significant risks. Is England the first to take this step? Actually, no. Countries like Germany, Canada, Australia and the United States have already included the chickenpox vaccine in their routine childhood immunisation programs. Data from these nations shows a clear drop in chickenpox cases and related hospitalizations after introducing the vaccine. For example, the US Centers for Disease Control and Prevention reports that over 25 years, their chickenpox vaccination program has prevented approximately 91 million cases, 238,000 hospital stays, and 2,000 deaths. This evidence strongly supports the benefits of widespread vaccination. But here's where it gets controversial. Some argue that chickenpox is a mild childhood illness and question the need for universal vaccination. Others worry about potential long-term effects on shingles rates or vaccine side effects. What do you think? Should chickenpox vaccination be mandatory for all children, or is it better left to individual choice? Share your thoughts and experiences in the comments below. Let's get the conversation started.